Hi, my name is Allison, and today I am doing the subcutaneous injection video for Nightingale College. So first I'm going to check the EHR and the provider's orders, and they have ordered heparin at 10,000 units per 10 ml strength. The 6 rights for medication is you got to have the right patient, right drug, right dose, right route, right time, and right documentation. So when I'm looking at the EHR and more on the provider's orders, I realized the doctor has ordered 1,000 units 1 time a day starting now. So after calculating that with the strength of the medication we have, that comes out to 1,000 units, which is 1 ml of the heparin. Yeah, so I'm gonna have all my stuff gathered and I'm going to knock on my patient's door, wait for them to welcome me in, closing the door and or curtain behind me, and go ahead and introduce myself. Hey, my name is Allie. I'm going to be your nurse today. What is your name and date of birth? Okay, I'm just going to verify that on your wristband. Okay, perfect. Okay, so today the doctor has ordered some heparin, and basically that is just a blood thinner to avoid blood clots in your blood vessels. Some side effects that you may experience is you might be easier to bruise and increased bleeding time if you get any cuts or wounds. As any injection, as I am inserting it or injecting you with it, you could feel a slight burning and tingling sensation, but that is normal. Some adverse side effects that I do want you to look out for is black tarry stools and blood in your vomit. If you experience those at all, I need you to tell me right away, okay? Do you have any allergies to anything, any medication, food, or any other substances? No? Okay, do you have any other questions for me? No? Okay, perfect. So I'm gonna go ahead and prepare our medication. I'm gonna perform some hand hygiene and put some gloves on. Okay, that glove broke, but I have more. Putting my gloves on. And again, I'm going to double check my medication to the EHR and provider's orders. So it is the heparin, 10,000 units per 10 mLs, but the provider has ordered 1,000 units 1 time a day starting now, and after the calculations that does come out to 1 ml. So I checked all of that. I'm going to take an alcohol swab and I'm going to clean my vial. And I'm going to get rid of my trash. Okay, and as that is drying, I'm going to get my syringe ready. Here we have a 1 ml 25 gauge 5/8 inch needle. So I'm going to take it out with the cap still on. And like I said, we do need 1 ml, so I'm going to draw back on the plunger to 1 ml. And by this time, my vial is dry. I'm going to take off my cap, put that down, inject the air into my vial, flip this over, and then I'm going to start drawing up my medication, making sure I don't get any air bubbles into my syringe. For subcutaneous injections, they can go into the lower abdomen, the back of the arm, or the upper thigh. Okay, so I have my 1 ml. I'm going to scoop my cap. And for this patient, we are going to use their lower abdomen. Okay, so here I have 1 ml. There are no bubbles. 1 ml. Okay, perfect. Okay, so since for this patient we are using the lower abdomen, I'm going to inspect that site. I'm gonna make sure there's no discoloration, no bruising, cuts. I'm also going to palpate it, see if there's any swelling going on, and just make sure it's a good site to use. And it does look like it is a good site. So I'm gonna let my patient know as well too. All right, so I got the heparin, drew up. Like I said, that is for the blood thinning qualities of it, and I'm going to inject it into your lower abdomen. Do you have any other questions before we start this? No? Okay. So with the lower abdomen, I'm going to pinch the skin and make sure that that is a good site too by the depth of the needle to make sure that it does have enough skin fold right there. So I am holding my syringe with my 2 fingers and my thumb, kind of like a dart. But before I do that, after I make sure it's a good site, I am going to clean my site. So I'm just going to take my alcohol. I'm going to go in a circular motion, about 2 inches. Get that nice and clean. Perfect. So I'm going to grab my syringe again, like how I was. Take off the cap. I'm going to pinch that lower abdomen skin so it does bunch up. And then I'm going to inject my syringe at a 45 to 90 degree angle. So I'm gonna go ahead. All right, Mr. Smith, here it comes. And then I'm going to maintain my pinch and inject this medication over about 30 seconds. Okay. As I take out the needle, I'm going to keep the skin pinched, so then when I take the needle out, the skin, as I let go of it, does kind of like close back up that hole. So I'm going to take this out. I'm going to discard this into my sharps container. I'm going to grab a piece of gauze, put it over the site. As I was saying, like as I was pinching it, there's a hole from where the needle went in, and then when you let go, it kind of flattens out and tightens back up on the skin. So like I said, put the gauze over it, not massaging it. Okay, Mr. Smith, we are done with that heparin injection. How are you feeling? Good, okay. Can I do anything to make you more comfortable, or are you okay? Do you have any other questions for me? No? Okay. So I'm going to gather my trash, take off my gloves, perform hand hygiene, and then document everything that I did for this injection, including those 6 rights, the correct patient, drug, dose, time, route, and then the correct documentation following. Thank you.